Hi, this is Tom Parker, CEO here at Mammoth Hospital, and with me today is Dr. Craig Burrows, Chief Medical Officer here at the hospital. We want to talk to you today about a couple of important topics. The first is masking, and the other is social distancing. I'm going to turn the time over now to Dr. Burrows to talk about masking.
So the first thing you're probably noticing is we're both wearing masks, and we have not worn masks in messages before. Why is that? Well, earlier this morning, our own hospital incident command team decided to recommend that all community members wear a mask when they're out in public. Just later this afternoon, it was reported that the White House may also be urging everyone to wear a mask as well when they're in public. We at Mammoth Hospital feel that doing this will help decrease the spread of the virus. So rather than waiting for an announcement from the government, we're asking you that you do this now. Our recommendation is that you preferentially wear a homemade mask that you can wash with soap and water at the end of every day. That'll keep the mask clean and help prevent you from wearing a contaminated mask or potentially making you or other people sick. Instructions on how to care for your mask have already been posted on our website, and they're also on Facebook on the Mammoth Hospital site. Wear your mask around people where distancing is not possible. That's our recommendation, as opposed to wearing it all the time. So examples of that are if you're living in a crowded living space, if you have to go to the store, which we're all going to have to do, if you're going to pick up food at a restaurant and there's other people waiting to do the same. The last thing I'm going to recommend, or that we're going to ask, is try as hard as you can not to touch your mask. Touch it as little as possible when it's on your face. And if you do have to touch it, wash your hands each time you touch your mask.
Thank you, Craig.
You're welcome.
I want to talk about social distancing. This has been a consistent message from us for the last several weeks. And we're now starting to get some, and you've probably seen as well, reports showing that there are major metropolitan areas such as San Francisco and Seattle who are starting to actually bend the curve and slow down the progression of the virus. We want to emphasize that social distancing is another extremely important way to fight this pandemic through slowing it down. Want to let you know that as of today, the hospital still has the ability to take patients who need hospitalization. The reason for that, we believe, is that our community is doing a terrific job in social distancing. And my message to you today is keep it up. This is not going to be over soon, so you've got to continue your efforts with diligence on social distancing. I think we can effectively slow down the progression, do what we all been talking about, and that is flatten the curve and give the hospital here the ability to have the capacity to take care of people who truly need to be hospitalized over the course of the pandemic. Like I said, it's going to be a while, so stick with it. Be patient, be diligent, continue your efforts in all three of the areas that we've been talking about for the last several weeks. Dr. Burrows talked about masks. That is simply part of the message about cover your cough. Now we're talking about having something in place that will help you to do that effectively throughout the day. Social distancing, it's huge. And of course, washing your hands. We know that the primary way that this virus travels from person to person is through hands and touching surfaces that have the virus. So keep it up, wash your hands, keep your mouth and your face covered, and by all means, be attentive to social distancing. And as Dr. Burrows mentioned, using the mask in those situations where it's difficult for you to maintain those safe social distances is key. We so much appreciate your attention to these points and for your support of your local community hospital. Thanks.
Distance, wash, cover.